Hello, everybody. I'm Will Schrank, Chief Medical Officer and Corporate Affairs Officer at Humana, and I am so grateful for the opportunity to join an amazing group today and to talk to you about our Bold Goal Report and a lot that we've learned about this year. This is an exciting time of year for us every year. The release of the Bold Goal Report allows us to sort of take stock around the work we've done in communities and to really sort of reevaluate the lessons learned and how to build on our learnings and continue to make progress caring for those in communities that need our help most. The Bold Goal program itself started in 2015 with the specific goal of building strength in communities by partnering with community-based organizations, by partnering with the places where our members congregate, with local governments, with healthcare providers, to try to build that social fabric to address the health-related social needs of our members and best promote the health equitably of all those that we serve. And every year we look forward to sharing these results in particular with our partners. The nature of the Bold Goal, the nature of any meaningful, effective population health strategy is based on partnership. There is so much of healthcare and so much of health outcomes are defined by not what happens when a patient is in a doctor's office, but what happens between those visits to the doctor's office, what happens every day in a patient's life, in a person's life. And none of us can individually provide all the needs or address the breadth of challenges that people face. And it's really for us as a company that focuses on improving the health of the population we serve, it's through partnerships and communities that we can really get personal about identifying the needs and the perspectives and the concerns of our members and really helping them on their trajectory to better health. This year was quite an extraordinary one for a lot of obvious reasons, and it really strengthened the partnerships we had and forced us to be much more creative, much more innovative, and much more transparent with our partners about what we did and didn't know and how we could work together better. So I'm really excited to introduce to you an amazing panel of folks to have a conversation. First is Jennifer Hancock, the President and Chief Executive Officer of Volunteers of America Mid-States. We have Ellie Hollander, President and Chief Executive Officer of Meals on Wheels. Preston Burns, the Vice President of Strategic Partnerships at the Institute on Aging, with a particular focus in the Friendship Line. And Nicole Lowry from Humana, our Director of Population Health Strategy. And I think one of the things that was sort of so notable about how we fostered our partnerships this year was just the fact that there was so much uncertainty throughout the course of the year. When you think about some of the big events in history, I think there are a few things that will leave as indelible an impression on our lives as the pandemic. However, unlike many of the other big events in history, there wasn't really that minute that demarcated that it started. You know, I can look back today and I know that last dinner I had, and then I didn't go to dinner again out to dinner again for another year. But I didn't know it at the time. And I think every single day thereafter, we were all just learning. We were all just trying to take stock and figure out what is happening. What's happening to us, what's happening to our families, what's happening to our communities, what's happening to our schools, what's happening to our hospitals. And that process of sort of continuous learning and the sort of remarkable day-to-day and uncertainty strengthened our partnerships in ways that I think none of us could have imagined. And that's why I think this year is a particularly fascinating one for us to get together and talk about what we've learned, share those learnings, and really build on some of the strength of those partnerships we've created. I did want to just share a couple specific results from the Bold Goal report that I think are worth noting. this was also a year that, with a great deal of humility and gratitude, we appreciated the opportunity to serve our members. In the setting of this uncertainty, in the setting of taking care of so many seniors who are vulnerable and who are particularly vulnerable to the uncertainties of the pandemic, we were in a position to learn more, gather more information, and to ideally be a really important part of the efforts to improve their health and improve their security and improve their peace of mind. And we were grateful to have had that opportunity, but part of that was a learning process as well. Early in the pandemic, as we were making outbound calls, it was clear that our members were experiencing different kinds of problems this year than what we were used to. We had set a goal this year of completing 3 million outbound health-related social needs surveys for our members. But it was clear early in the course of the pandemic that we needed more, that we needed to be in contact with our members more frequently. We needed to be asking them very openly and transparently what were the problems that were facing them. These are problems that likely they didn't have a month ago or 2 months ago, and we needed to really open up that line of communication. Fortunately, this was not the first time they were hearing from us. We've had, a long-standing relationship with our members. We've been calling them every year, but this year in particular, fortunately, I think we had built some trust. This year we made over 6.2 million, in fact, completed outbound surveys to collect information about health-related social needs. In part with the support of Meals on Wheels and Ellie Hollander, we were able to deliver 1.1 million meals to our members who are food insecure. And at a time where we track patient self-reported healthy days in our local markets, both physical health and mental health, with the goal of really trying to improve patients' self-reported health and experience. And in a year that across the nation, we've seen reductions, or we've seen higher levels of unhealthy days or lower levels of healthy days, and certainly big increases in mentally unhealthy days. In our BOGO markets, we saw modest improvements. And it really speaks to the fact that during this time, the ability to kind of be there, part of the solution for our members was critical. And it really is all about partnership. It's all about having partners on the ground in communities that we can roll up our sleeves with together and solve problems together. So I'd love to dig in here and ask our esteemed panel some questions to really capture some of what we've learned this year, and some of the learnings that we can build on. So I'll start with you, Ellie. I think historically, you think of a Meals on Wheels organization as really focused on food. But this year, where so many folks were feeling isolated, who had difficulty seeing family members and friends, the fact of actually being at the front door and delivering a meal offered different kinds of opportunities to engage with, and support the consumers you were working with. Tell us a little more about that.
Yeah, well, thanks, Will, for the question, and it's a pleasure to be here with Humana and this great panel. Meals on Wheels has always put our seniors front and center, looking holistically at their needs and addressing what we call the social determinants of health before social determinants of health were even recognized as so pivotal to health and well-being as healthcare has now recognized. And as you said, because of the trust that the Meals on Wheels brand carries, our staff and volunteers are invited into the homes of millions of at-risk seniors, enabling them to be the eyes and the ears, identifying the needs of the whole person and providing more than just a meal. And we always say that the meal is simply the entree, if you will, as our programs, provide friendly visits, they make the safety checks, they note changes in physical and mental health, and they connect seniors with other services that they might need, whether it's transportation and home repair, to pet care and even vaccinations during the pandemic. In light of COVID, though, Meals on Wheels programs nationwide had to suspend service at their senior centers and turn them into drive-through, grab-and-go meal sites for those seniors who are more mobile. And we also had to adapt our normally very high-touch model for homebound seniors to touchless delivery, maintaining physical distance, but delivering essential social connectedness, ensuring that our seniors get that nutritious meal, but also have a conversation and know that someone was checking in on them. Meals on Wheels did see an explosion in need that resulted in 77% more meals being delivered and to 47% more seniors at its peak than they were seeing prior to the pandemic. And we're expecting, all indications are that there is still a sustained need of about 39% higher than before the pandemic. And we don't believe that is going to retreat in any way. And so the question really is, will the resources be there to support this additional need? 86% of Meals on Wheels programs don't even feel that they're meeting the current need in their communities. And 62% say that they will not be able to sustain this increased service without additional funding. So Meals on Wheels can't do it alone, and we've long recognized the power of public-private partnerships and in reaching this highly vulnerable, underserved population and getting desperately needed support directly to the front lines. And Will, Humana and your team, the Bold Gold team, has been a strong and sustained partner, stepping up to support our programs and the seniors they serve for years. So this isn't new, but to your point, the power of partnerships.
Well, thank you, Ellie. And I'll remember that the meal is only an entree. We'll transition over to you, Jennifer. We do a lot of work together with Volunteers in America, focusing on specific populations. And I think as you've really gotten closer to the unexpected needs and the uncertainties throughout the pandemic, you've had to change your strategies as well. Can you tell us more about that?
Absolutely. Good afternoon, everyone. It's a pleasure to be with you. Volunteers of America, we've long served a highly vulnerable population of women who are pregnant and parenting and substance use disordered. And we had planned in 2019 to expand our program into Appalachia, southeastern Kentucky, a community that desperately needs these services. And we were ready to open our doors right as the pandemic descended on Kentucky and on the nation. Our team made a decision to move forward and push ahead despite the growing concerns of congregating families in a setting together for residential treatment. We weighed the balance of risk of not opening the program or the risk of proceeding and decided that we would leverage telehealth capabilities inside of a residential program. So historically, you think of using telehealth in outpatient settings. Well, we decided to go ahead and move forward, bring families into treatment, knowing that women who are pregnant cannot wait. If we're going to intervene and interrupt this cycle of addiction and have a chance at delivering a healthy baby, we have to open this program. So the second week of March of 2020, we opened our doors and began welcoming moms and their children to this program in Manchester, Kentucky. And we took the telehealth capabilities. Instead of congregating women in group therapy together in one room, we let them dial in to a Zoom chat from their personal bedrooms and decided that we were going to mitigate the risk as best we could, but move forward in making sure that this program was accessible to those who need us the most. I have to tell you that we were full within a matter of weeks. By November of last year, we delivered our first healthy baby to a Humana member in that market. And we're already now planning in partnership with Humana an expansion because we are full with a waiting list. So the pandemic, not only did it not slow us down, it really accelerated our willingness to try some new things internally. And we had to double down on our efforts to message and market this service and making sure people knew that not only are we going to be accessible, we're going to be a safe alternative to continuing to remain outside of treatment. The risk of COVID pales in comparison, frankly, to the lethality risk facing so many of these women. So we're really proud of the fact that we bravely moved forward and the community came along right there with us and have championed and supported our efforts every step of the way.
Well, we are so grateful for your flexibility and the way you're able to make mid-course adjustments to meet the needs of our members and the members of our communities. Nicole, as we talk about the fact that we massively expanded our outreach to identify health-related social needs, identifying a problem and addressing the problem are two very different things. How did we go about making sure that we were sort of filling in those gaps and that we were not just collecting information, but really doing something meaningful about it?
I think the first thing that we need to note here is we did have a lot of data on our members. However, we had been piloting, testing some different interventions along the way, and it's through the power of the partnerships with the folks who are on the phone and some other partners across the country, where we had created a very large sense of trust, not only with the community partners such as Meals on Wheels and VOA and the Institute on Aging, but we've also had created a very trust-bound relationship with our members. They pick up the phone when we call. Our members actually started calling us for things that we wouldn't typically address, such as needing food. There was no food in their pantry. There was no way for them to get to the food. Even if they could get to the food, companies like Instacart were running on a 2 to 3 week wait time. And so we were able to execute very quickly on several programs, which allowed us to provide food to our members, which allowed us to address the loneliness and social isolation component, which we all know was so great during that time. People were no longer out even taking walks or going to church. And so we quickly were able to fill some voids there as well. And we'll get into those in a minute. I think it's really important to note that we all know during the pandemic that mental health became behavioral health became a very big problem for any of our members or any of us who may have been on the verge of being depressed. As we sat back and were bound to our homes and not able to have those social connections, we quickly put a few interventions in place. And one of them, Preston's going to talk about in a few minutes, is the friendship line with the Institute on Aging that we created just for Humana members to call in to be able to talk to someone when they needed it. It was the great partnerships with VOA and Meals on Wheels that allowed us to outreach to our members to meet their needs at the exact point in time. We did see, as anyone would expect, during this time, an increase in our mental unhealthy days. And so we quickly were able to step in and to start doing some proactive outreach to these members as well. So one of the things I would want to make sure that we do highlight was our ability to work with these partners who are with us today to move forward and create some interventions. And so, you asked how we ensure our needs are met. Well, a couple of ways. We do survey members, so we understand what their needs are. We test our interventions along the way to make sure we're getting the outcomes that we expect. And some of these just really aren't traditional medical outcomes. These are outcomes such as experience. Does the member's social gap close? Very different than the member gap. That doesn't mean that a member goes to the physician's office. It doesn't mean that a member has a mammogram? No, did we see a decrease in food insecurity needs whenever we provided the meals? Did we see a decrease in social isolation and loneliness when we provided the friendship line? And so through that surveying and through some research that's still ongoing and feedback from the members directly when they called in to talk to us about the program, that's how we were ensuring the needs were met.
Thank you, Nicole. It's really helpful. And you started to signpost, this real focus on social isolation. And Preston, I'm sure that there was just so much more visibility this year than ever before around social isolation as a real problem, as something that needs to be addressed, and even as a really critical health risk. Considering your work at the Institute on Aging and the Friendship Line, really you were in a unique position to be able to make a difference. Tell us a little bit about what you learned about the community's needs during COVID, and how that's translated into sort of how you do your work at the Friendship Line.
Absolutely, and thanks for having me. And it's exciting to be a part of this today. And I think it's pretty obvious to anyone who has a relative, particularly an elderly relative or others who were already expressing perhaps isolation and loneliness prior to COVID, and then saw those experiences just increase. And so for us, we are obviously talking today primarily about the Friendship Line, but Institute on Aging also has a PACE program, and we do skilled nursing transitions, dementia programs, home care, all those types of things. And we just saw the need grow across the board. All of a sudden, every one of those programs was, more in demand than it ever had been. While at the same time, we had to shift our approach to delivering many of these services into a fully virtual or just a different structure simultaneously. So, an exciting year for us all, certainly, but for the Friendship Line, I don't think it's any secret that, Humana has been ahead of the game in this space for a while now, thinking about the ways in which loneliness and social isolation connect to physical and mental health or behavioral health. But we've been operating the Friendship Line since 1973, and it hasn't always been, the most. It hasn't always felt like the service that the healthcare or other communities were most interested in. That folks necessarily weren't paying as much attention to the ideas of social isolation and loneliness as Humana and others have really made folks think about now. So for us, what we saw was growth. We had new partnerships with Humana and with CDA, California Department of Aging, which built a statewide version of the Friendship Line to support the residents of California. We saw about a 20% growth in calls, which, is pretty significant for us because typically we've had a pretty consistent base of folks who know about the Friendship Line and who reach out to it regularly and have valued it for years. We had new callers with new needs. For one, we saw a lot more anxiety. On the surveys we've done, we saw a lot of folks rating as highly anxious, our median score being highly anxious on the GAD-2. And we saw increasing isolation. So as many as 75% of folks were saying they have no weekly community engagement at all. 42% of folks said they had no in-person interaction with others during the past week. And those are just much higher than we had seen in the past years when we've done similar surveys. So for us, this is obviously a problem that needs to be addressed, and we're hopeful that we were a part of solving that. But it also gave us the opportunity to establish connections with members or with individuals due to COVID who may not have otherwise come across us and may not have otherwise thought about connecting with a service like the Friendship Line. And we've been able to establish ongoing relationships with those folks to have an impact. And so, every problem is an opportunity, right? And in this case, I think we've definitely been able to make some good out of this challenge over the past 18 months. I mean, Ellie mentioned kind of the eyes and ears. I guess in our case, we're more just the ears since we don't, talk to people or see people in person. But we've also heard quite a bit from folks as Ellie's team at Meals on Wheels does about their needs and how things are changing for them. And so have had to think on our end about how we can increase the way in which we address kind of referrals. or other service connections where we can be impactful in more than just being a friendly ear to listen to folks' challenges or just have a chat. And then, finally for us, as we know we've grown and we've seen the demand increase, we've also looked internally and seen if there's an opportunity here to serve needs in new and better and different ways than we have pretty much since 1973. We've been a phone service. So looking at improving our internal systems, moving more fully remote so we can engage Friendship Line staff and volunteers in different parts of the country, and prepare for video and text as kind of the next evolution of how we can connect with folks. So, as with others here today, certainly growth in need and also opportunity for impact, but hopefully also evolution, because really thinking about different ways to serve different populations and different communities has been a real benefit for us as we've experienced this unfortunate time.
Yeah, I mean, it's interesting that the telephonic technology, maybe it's not the newest, but sure did come in handy over the last year and a half. And I do love that point that you found new sources of referrals from the community that you hadn't found before. I think, Ellie, you've said the same thing, that there are just new ways that within communities we're seeing partnerships. And Jennifer, I'm sure that's true for you as well, that across communities, we're learning more about each other's capacities, each other's areas of focus, and how we work together to create more of that fabric of support. And Ellie, maybe I'd love to ask you. You've highlighted this notion that you're the eyes and ears, but this really helped you at Meals on Wheels think about how you can meet the needs of vulnerable people in new ways. How do you see that sort of playing out in the future? How do you see that this is creating sort of a pivot for Meals on Wheels as a way to have a bigger impact?
Yeah, well, before we go there, I just want to emphasize something that I think is really important that Jennifer and Preston and you have all highlighted, which is, the pandemic not only laid bare two pre-existing epidemics, senior hunger, which we talked a little bit about, food insecurity, and social isolation, but it also has propelled an entirely new pipeline of older adults to homebound status. And I mentioned earlier that we believe that the sustained demand for Meals on Wheels of an increase of 39% is here to stay. I mentioned also that Meals on Wheels, you remembered, it's the meal's the entree, but it's more than just the meal. And we've always recognized that as important as the meal is, the socialization that comes along with it is just as important. And thanks to COVID-19, and Preston mentioned this, we've all experienced what it feels like to be isolated and lonely. But for the vulnerable population that we serve, this is part and parcel to what they experience on a daily basis. Because often the Meals on Wheels staff or volunteer is the only person that a senior will see in a given day or even a week. And while the rest of us begin to return to our new normal, whatever that will be, this is the norm for millions of seniors. And to the point of the lack of physical and mental stimulation that we just heard about, the fact that anxiety and depression is going up, for many of our more mobile seniors who were able to get out prior to the pandemic, but a year, 13, 14 months of sort of being homebound with no social or little social interaction has really had a tremendously adverse effect on their overall health and well-being. And as I mentioned, I think this is going to render many more homebound for the longer term. And that's why Meals on Wheels, and in partnership with Humana and other partners here on the call, have stepped up its focus on social connectedness. And we've been working with you to prop up a friendly visitor program and to be much more vocal about all the resources that are available to folks so they know that they're not alone. And I spent a lot of time helping to promote to all ages the fact that there is this website and tips and tricks available to people so people know that they aren't alone, farfromalone.com. And I think that's important to emphasize. But, we've used technology as well. We have used, since senior centers are closed down and seniors were used to getting together and socializing, virtual connections to see how people can stay in touch, having a meal at the same time with groups of people and so forth. But we believe that whether it's telephone, whether it's in person, we need all of these. There isn't a one size fits all because, as you know, folks in rural areas that don't have broadband, it's very difficult to be able to have telephonic or other links there. So we need to continue to stay with the tried and true, the interpersonal connections augmented by technology.
Could not agree more. Let's shift the conversation a little bit to data. We highlighted how we're all collecting a lot more. So the recognition of the need has forced us to be much more proactive about collecting information about health-related social needs, about the challenges that patients, members, community members are experiencing. And it's also really prompted us to be better about sharing with partners, and better about making sure that we're closing those loops. It's not enough just to identify a problem. We need to be able to, create those sort of partnerships that allow us to share data and act on it. Jennifer, could you talk a little bit about sort of in that spirit of public-private partnership and data sharing, how that's really accelerated your work at Volunteers of America?
Sure. So I love this question because I think it speaks to how we can continue to grow and strengthen our partnership. Because when I think about Humana and the data sets that you all have available to you, and how great it is for a provider like Volunteers of America to be able to look at this global set of data and understand the story that it tells, and then to take a data point and contextualize it to a real person that we are serving, and to see that person in his or her environment and understand the context for how that data comes to life. So as an example, it's interesting, when we offer this Freedom House program in an urban market and in a very remote rural market. The social determinants of health and the challenges of the population of pregnant women who are substance use disordered, very similar. Social isolation, food insecurity, transportation, very similar complex challenges in an urban market and in a rural market. And yet the solutions to address those challenges look quite differently. In Louisville, Kentucky, we recognize that lack of access, transportation that allows access into treatment immediately once someone identifies they're ready to begin that journey of recovery. This is a phenomenon where you used to be able to say, well, schedule your intake tomorrow. It has to be on-demand access. We have to schedule immediately as soon as we get that call. Otherwise, the person may change their mind. They may start craving again. They may start going through withdrawal and begin to use again to subside those types of symptoms. So we have to act immediately. Well, if they don't have transportation, we've now decided we will get an Uber or a Lyft and build that into our budget and remove any barrier to get someone immediately into treatment. In Southeastern Kentucky, they don't have an Uber or Lyft service. So we had to buy a VOA recovery vehicle that is staffed by a peer support specialist, someone who has lived experience, to go out and provide immediate access to treatment. Two very different solutions for two very different markets that have a common problem. Being able to share data back and forth from a provider perspective is extremely valuable, because we can begin to forecast what those future trends are so that we can get ready to be nimble and responsive programmatically. And then being able to give you access to our data to understand what that really means for individuals and families that we have direct access to, eyes and ears on 24 hours a day in our residential programs, is so extraordinarily valuable. It really gets me excited about what we can do, continuing to leverage that data as we move forward in the future.
Yeah, it's really powerful. And maybe to build on that, Preston, I know together we're doing some longer term studies, and we can't share results of those yet because we need to give it a little time to run out. But can you talk a little bit about sort of what you've been learning about folks as you've talked to them? I know you shared some about the high levels of anxiety, but just in general, and what you think what we're going to learn from this as we do have more time to follow our members and learn about their experiences.
Sure, and I would absolutely echo everything Jennifer said about how the power of data and quality information from managed care plans can be really instrumental for organizations like ours in designing and evaluating, our various different interventions. But yeah, we've got some, surveys that we've performed so far with, the Humana population, and certainly are finding some interesting things so far. One of which is we may need to be tracking smoking cessation, as one gentleman commented that picking up the phone and calling the friendship line helps him to not smoke a cigarette. So perhaps something to consider there. But in terms of some early responses, again, not with the robust data that we're working with the University of California, San Francisco on the evaluation plan of, but on initial Likert scale responses about impact, we're seeing things like mental health improvement from our services of 71% strongly agree, less lonely strongly agree 73%. The more interesting pieces perhaps that up to about 48% of folks answer either strongly agree or somewhat agree that something like the friendship line helps them avoid ED visits. And another 47% strongly or somewhat agree that friendship line improves their physical health. So, those are the beginnings of the research questions I think that we have and that you all at Humana have had for a long time about how these connections exist between healthy days, both physically and behaviorally, and, interventions like this, ours around social isolation or loneliness, or what Meals on Wheels or VOA are doing as well. And so I think that's really our hope here, is that we've never had the opportunity to work closely on outcome evaluation with a managed care plan data set. And so we hope to kind of marry what UCSF and we find on the kind of more qualitative side, where we know that we're having a positive impact for these folks. We know they're experiencing improvements in their mood and in their anxiety and in their loneliness, but can we connect those dots back to outcomes that say these investments in these interventions that we've been talking about today actually result in hard dollar healthcare cost savings? And, healthcare avoidance, healthcare cost savings, those are very challenging concepts to materialize sometimes, but I think for us, being able to say that investing in a partnership like the friendship line for a managed care plan being worthwhile, not only because it's the right thing to do, which I think all three organizations speaking here can clearly say we're doing the right thing, but that there's also a quantitative fiscal and healthcare outcome impact, and that may or may not prove to be true, but at least working to answer the question will be very exciting. And so we're looking forward to getting more data back over the next 6 months or so about the outbound calling program that we're doing as part of this study, to really see if that's the case. And again, without a partner like Humana, who has access to this data and these insights, we really wouldn't be able to do a study like this that obviously speaks to impact, but also could tell us, ways to improve what we're doing. So we're very excited about what we might find down the road here.
Yeah, thank you. We are too. I mean, that quantitative information is going to be so valuable. And I do want to also echo your comment that there are a lot of different outcomes here that matter. And it's great if we can avert a hospitalization. It's great if we can improve encourage someone to manage their chronic disease better, but it's also great if we can help somebody with their perceived social isolation and their experience. And it all matters. And it's great that in this evaluation we'll be able to capture all those different features of the experience and health outcomes of our members. Nicole, we'll finish up with you here. We've been talking a little bit about data. Anything from the Bogle report that you'd want to either shine a light on or that you found surprising?
Definitely shine a light on. Don't know, surprising is the word, because I feel like for the last 6 years, Humana has done a lot of work to get to where we are in addressing health-related social needs. So I will say that from our baseline year, which was 2015, just to remind everyone, through 2020, what we found is overall for our Medicare Advantage members and the members in Bogle markets, we saw a decrease in physical unhealthy days. We did see an increase overall in mental unhealthy days that I think we've all talked about throughout this panel. So overall, for Medicare Advantage, we saw a decrease of 2.4% in our physical unhealthy days, and in our Bogle communities, a decrease of 5.1%. In mental unhealthy days, we did see an increase of 5.4% for our Medicare Advantage, but in our Bogle communities, remember, where we have a lot of very focused attention and also boots on the ground who are out in the community all the time, we saw an increase of 2.2%. So overall, in our Bogle communities, we saw unhealthy days go down by 2.2% overall, which is huge. Want to also say in Louisville, which is Humana's hometown, we've actually seen a really big positive trend. Want to point this out. We've seen unhealthy days go down by 1.8% year over year. And part of that goes back to, over the last several years, we have increased the number of social needs screenings. Dr. Shank talked about how we conducted a little bit over 6 million in 2020, which has led us to really have the data we need to make informed decisions to make a difference. Also would like to point out in our basic needs program, which was a COVID response. This is some late breaking news. As of yesterday, we have provided 1.4 million meals to at-risk members. So members who don't have the means to or the transportation and have chronic conditions who are food insecure. And over this last year, by some of the interventions, we have seen the percentage of needs met in food insecurity go up to about 43%, almost 44%. For financial strain, when we've been able to intervene, we have seen some really great gap closures as well, of about 14%. And same with medical and non-medical transportation. We have seen both of those increase quite a bit through the pandemic by working with great community partners, great national partners. One of the things I think that we want to just reiterate again is that we cannot do this alone. This is a partnership, something we've been at for a really, really long time, and very thankful for our partners here on the phone with us and the partners who aren't on the phone with us today.
Well, thank you, Nicole. And we only have a couple more minutes here. So just to close out, we are just deeply grateful for the partnerships we have in the communities that we serve. We know that these are hard problems that we're trying to solve. We know that the unpredictability and the uncertainty of the pandemic really accelerated that urgency to try to figure out ways to solve them. And we know that it's not just about identifying our roles, but it's about really rolling up our sleeves together and being willing to be vulnerable and to share that we're going to make the greatest progress. And couldn't do it without the great partners that we have here on this call: Volunteers of America, Meals on Wheels, the Institute on Aging. I also want to just highlight that this is also a time that we've recognized that that not all populations have been impacted the same, and there are populations either that vary by the color of their skin, that Black and brown populations have had really profoundly worse experiences throughout the pandemic, that there's certain communities, there's certain regions, there's a whole we have there's a really bright light that's been shown on the disparities in health outcomes and care and experience that Americans face. And it's forced us all to be more intentional about how to measure, and how to address those issues of disparities. We're implicitly trying to address many of them in the work we're doing together. And it's sort of that part of the next generation of our work is to be more explicit, more intentional, more focused on not just improving the health of all Americans, but doing so with a real focus on promoting equity in that effort. And we're grateful to have partners like Ellie, Jennifer, and Preston that we're all ready to roll up our sleeves together and try to address this as a team. So I just wanted to, and I just watched Ellie actually roll up her. So I just wanted to finish by saying thank you to our partners. Thank you to everybody who came to listen. It is really a great honor and pleasure to be able to work with such amazing folks, and to be able to learn together and kind of continue to try to push the ball up the hill. And I can't wait to be here next year to talk about what we learned. Thank you all.